Now, this information is for our beauty professionals all around the world. Hello, friends. Hello to all beauticians, to all our partners all over the planet. This question really reaches me quite often, especially now that we are building up the range of the Dermaceutical Concentrate Ampoules. And the question comes along quite often: is it possible to use the ampoules for needling techniques? Of course, yes. Yes, we can, and yes, we want to do that. Quite basically, BDR is famous for our stimulation technique, which is a minimally invasive needling technique that we have been inventing 22 years ago already. So we were the first one to really use the vertical needling. And of course, as we are not penetrating the skin deeper than the law allows us, and that we are not penetrating down to the bleeding areas, all sorts of our products can be used after the needling and during the needling. The ampoules, as they are sterile, as they are clean, as they are concentrated, there's no perfume, no extra excipients that are not needed. They are perfect as a monodose for needling techniques. So hyaluronic acid anyway can be used right away as the first ampoule for all sorts of needling techniques. After that, for anti-aging, I would always recommend to use the stem cell booster. Be aware, using stem cell booster together with stimulation and needling techniques might feel a little bit overactivated in the first few minutes right after the treatment. Even some clients that went through the treatment with a stem cell booster would report us that up to 2 hours they feel this kind of activated tingling in the skin, so they really feel a lot refreshed. But scary clients might think that's a kind of intolerance, which is not. It's just like a pure activation. Rosa Calm, of course, we want to support the density of the tissue, especially in the area where there is rosacea located. And Rosa Calm is the major perfect product to strengthen the vascular system. But if we are using the needling system together with the Rosa Calm, we have an extra benefit, as the more dense tissue around the vascular system will act like an extra compression and stop the blood vessels from the dilatation that occurs from the inflammation processes. The only ampoule that doesn't necessarily make always sense to use with a needling technique is SOS Boswellia, because this SOS ampoule comes along especially for those clients that we usually wouldn't want to do a needling technique. Let's say neurodermatitis, psoriasis, a rash of allergy, a rash of any sort of imbalances. So when the skin really got over the top, that is when the SOS ampoule usually is used to bring the skin back to a normal condition, to stabilize the immune system, to lower the inflammation process. So it is not because I am not allowed to needle this ampoule. It's because the skin condition that this ampoule is perfect for actually is not asking for a needling technique or for a penetration technique. We have fabulous results, especially on acne patients, highly inflamed skin, with problems of acne, or like the last state of rosacea, when it's really papulopustulosa, when we have like swelling, redness. Then also boswellic, the SOS Boswellia with boswellic acid can be used. But again, that would not be necessarily the skin area that I would want to use the needling technique right from the beginning. So quite basically, yes, we can use it together with stimulation, but that sort of skin that really benefits from that ampoule would not ask for the needling. I hope I could help you with this information, and whenever there's more questions, never hesitate to contact us and we will produce the video and send it back to you. Bye bye.